It's the fight! He's going! I've got it! Oh, quick, get in there! Get in there, quick, get in! Oh my God! Get in! You see the blood! You see the blood! I'm getting it!
It is estimated that in the U.S., over 30,000 teenage girls get pregnant before the age of 15. However, teenage pregnancy is also becoming a problem in Indonesia. As it is shown in the graph, the teenage pregnancy rate increases as the years go on, and Bali has the second highest teenage pregnancy rate in Indonesia.
Well, I mean, I think teenage pregnancy occurs because teenagers are having sex, and they're not, they're acting on an impulse, and they're not really taking the proper precautions. Well, it's going to be a pretty major traumatic event in any teenager's life, both for the girl and for the boy. To be told, to find out that you're pregnant is going to be a shock. Even though some kind of maybe expect that they're pregnant, it's still a shock when it's confirmed. And I think the same happens for the boy when he's told that, he's made someone pregnant. It's a shock as well. I think after that, after the shock wears off, that's a pretty major decision to make, what to do once people know they're pregnant. There's a couple of choices a person can make depending on their own beliefs, but those are still difficult choices for anyone.
Teenage pregnancy.
Well, I think a couple of ways. One is to slow down. I think be careful about, getting too drunk. Okay, so it is related to abusing drugs and alcohol. If you get, where you lose control that way, you're more likely to make decisions you wouldn't make when you're sober. And to understand, how to use birth control properly, and the implications, that come with having sex is that you can get pregnant. Okay. Well, they can come to the counselor and ask for help. I can help them, learn to cope, kind of lay out what decisions they want to make, to help them think about the consequences of each decision, to help them find ways that they can tell other people about what's going on. I've only been in Bali a short time, so I would rely on the school nurse, who's Indonesian, as far as what other options they have medically, for whatever their choice might be. So those would probably be the two areas where students at BIS could get help from people at BIS.
Okay.
Well, I think it varies from country how available contraception is. Condoms are pretty ubiquitous. You can see them in most pharmacies, and if people can get over the embarrassment of buying them, that's an effective form of birth control. It gets a little bit more difficult if for example, from country to country for girls who might want to go on the birth control pill or something like that. But then that doesn't help you avoid STDs It just keeps you from getting pregnant. So here, though, condoms seem readily available. As far as I know, finding hormonal, like birth control pill, is not that difficult. So I think here, people can find it pretty easily.
For all of the things, it's not really a big role, but we have a system. Sport is not really sport, but they only give you advice. You have to do how to check your pregnancy. Normally, people said in your family when you get pregnant like that, you can whether get married to do abortion is not allowed to do that in law. No. I don't know, not many people. I think some people do it and some people must go to a doctor and check. Before they get married.
Yeah.
They normally, the parents and the children who they love with them making the baby with, they usually come and talk, discuss what they normally do. They have to take them to talk together, find a solution, and normally they get married. Well, none of us is really like to be like that, but something that happens, we have to find a solution.
Some of the consequences of teenage pregnancy in Indonesia is getting kicked out of school, which means no further education for girls, and it is also considered bringing shame to the family.